Mr. Georgiades, international medical experts complain the consequences of the drastic cuts in the budget of the Greek healthcare system is the death of several hundred people per month because they have no access to proper treatment and medication. You are the responsible minister. Can you sleep well with this allegation?
No, I couldn't sleep well, and this is the main reason that we made the reform with WHO in the primary healthcare system, in which 2 months now we gave access to everybody, and from until the end of June everybody will have access to the hospital treatment and to the pharmaceutical expenditure as if they were insured. So until no more the end of June, for the first time in Greece we'll have a universal coverage of everybody.
Mm-hmm. But up until now many people had no access for several years.
Yes,
no?
because the system was relating having job by having your access to the system through the social funds. So since the unemployment was exploded from the 8% to the 27.9%, many people lost their job, and since they lost their job, after a year they lost their insurance capacity. And this is the main reason we made the reform, to change that.
Mm-hmm. But at the same time, while unemployment was exploding, as you said, the expenditures for healthcare system has also been cut very severely, no?
They should.
The memorandum of understanding...
They should be cut, because this country mostly bankrupt because of the health field. In this area we were spending enormous money, and many people became extremely rich by cheating Greeks' taxpayers' money.
But according to the Memorandum of Understanding, the treaty signed by the Greek government and its creditors, the state expenses on healthcare had been cut to not to exceed 6% of GDP. This is far below the European average of 8% and even less in comparison to Germany, for example, our country, where public health expenditure costs around 10% of GDP. Thus, even in relation to the shrinking economy,
and in the United States, it's 16%. Each country can spend the money each country has. But I will give you my personal opinion.
But it's even in relation to the economy, you know?
Let me hear my personal opinion.
Yes.
In the next years, in all the European countries, there will be cuttings in the expenditures, because the figures cannot go forward. This is the reality. I mean, most countries will follow Greece's example.
Well, but you have shrinked the Greek healthcare budget to levels not seen in Europe for decades.
By doing reforms, because now we are giving, as I told you before, universal coverage, and when we were spending 3 times more money, we didn't have universal coverage. How can you explain that?
And how do you cover these uninsured in future without spending more money?
Because we buy the drugs and we buy the healthcare services and we buy the materials much cheaper. I will give you an example. Before the crisis, we were buying one machine for the heart, for the heartbeat.
Yes.
2,000 euros. Now we're buying the same machine with 120.
And
exactly the same.
And
if you go to cemeteries in Greece, you will find graves that inside the grave this machine still functions because it had been put into people that they didn't need it, just for cheating the country.
Yes, but the healthcare budget has been cut by 25%.
Oh, yes. It will not be cut anymore. As you said before, it's related with the GDP. I think that as Greece exiting the crisis, the GDP will increase, and so we'll have more money next year.
But you have a lot fewer doctors available to ordinary people. For example, in the primary level, formerly there were more than 5,000 and now there are only 2,000.
See what happened. October was the last month the old system of primary healthcare was functioning. we're having 600,000 appointments per month with 5,000 doctors. Okay? 2 months now, it's working the new system, the reformed system. And on April, the first practically month, we had 500,000 appointments with half doctors. 600,000 was with the 5,000 doctors, and 500,000 were with the 2,500 doctors. And in May, the month we're running now, we have more appointments than we had with the 5,000 doctors. How can you explain that?
I can't.
It's very easy. They weren't working so much before because they were going there only for 3 hours, now they go for 7.
Well, but we talk...
You see, 5,000 doctors, if they work for 3 hours, they do less job than 2,500 doctors for 7 hours.
But according to the official figures, at least 2.3 million Greeks had no access at all up until now.
Before the reform. Now, everybody has access to the primary healthcare. If you see the advertisement in the TV, you will see that they pass some advertisement with the numbers you can call in order to have an appointment with the doctor in the primary healthcare system. And they say, for insured and non-insured. This is for the first time in Greece.
But we talked to several doctors who had told us the opposite. For example, they had patients suffering from cancer who had been diagnosed in an early stage.
As I told you before, this is for the primary health care.
Yes.
Now you say for the hospital care. For the hospital care, it will start function, I said to you before, until the end of June.
And for primary care?
For primary care, it's already been working. 2 months now.
But
for hospital care, 1 month from now.
But there are many patients still who say they are refused to by the official system because they have
debt. In the primary health care?
Yes, because they have debt to the state, they are not accepted anymore.
Not true. You can see all the legislation that has already been passed from the parliament. It's working through 2 months. You can see all the advertisement in the TV.
But I was told that
when you go to primary health care, nobody has even the authority to ask you if you are insured or you're not insured, even if you have debt or you don't have debt. You just give your AMCA. AMCA is the number of the social fund number we have, and you are being examined by the doctor for free.
Well, we have met witnesses who told us the opposite. I was told that, yes, in general, this access was granted, but only to those people who fulfilled certain criteria.
No criteria at all.
No criterion at all?
No.
So
in the primary healthcare. Now, what we will do in the hospital treatment, it will be, as I will say to you now, you have to make an appointment in the primary healthcare if you are, let's say, uninsured. If the doctor gives you a paper that says that you need hospital treatment for a disease, you have to go to the hospital with this paper. In the hospital, 3 doctors, the director of the doctors and 2 other doctors of the medical care you need, they will have to decide if what the primary healthcare doctor said to you, and if they agree, they will have to give you full hospital healthcare service for free.
If it's true what you say, why this hasn't been done much earlier?
Because
why for such a long time so many people had to suffer?
We didn't have the keys to control the hospital expenditure that we have produced now. Now we made everything through computer. Until the end of June we'll have codification of all the medical services and the medical materials, and we make central tenders that gives us the way to buy things much cheaper than we were doing before. So we save money from the one hand and we spend this money on the other.
So after 3 years and thousands of people suffering and getting no care, suddenly you promise a miracle and turn it around in only a few months?
I don't promise. This is not a promise. It's been written to the memorandum with the Troika. It's a milestone, the legislation for until the 31st of May. It's been announced before the Euro elections. In the primary health, it's already been working, and we need another 2 steps. The one, the hospital service, it will be signed a common ministerial decision between me as the Minister of Health and the Minister of Labour until Friday. And the 3rd step we need is to sign another ministerial decision about the pharmaceutical expenditure of these people. I think it will need some days more, but it will be finished until the end of June, because we're waiting some money from the government.
If it's true that everybody has access, why then these voluntary social clinics are so overcrowded by people who say the opposite?
Because we didn't have it until now. Until after the 30th of June, there will be no need of these social medical services anymore. The first, as I've learned, it closed in Mytilene Island. It closed because of the primary healthcare system, and it closed. They sent me an announcement that they are closing because the people were going to primary healthcare. The main objective of the government is giving universal coverage to everybody. We think that this is the responsibility of our government and our society, as Greeks and as Europeans.
One very serious problem which has developed over the last 3 years in Greece is the growing number of people with infectious diseases, like tuberculosis, hepatitis, AIDS, and who received no treatment. In these cases, even from a purely... please let me put my question. In these cases, even from a purely economic point of view, the cuts are counterproductive because these people are infecting others, and through this the damage will be greater than the savings.
There is no way having no treatment. If you have tuberculosis, if you have HIV, if you have hepatitis, we pay everything for everybody. You cannot have no coverage for the medicines if you have these kind of diseases. There are some bureaucratic problems. Let's say we had 5 people from a medical social center in Ellinikon who had 5 people with hepatitis who didn't take care of their drugs. They sent me a paper here. I said them what the law says. They should inform the company that gives us these drugs about the AMCA and the name of these people in order to give them medicine for free. I don't know if they have done it yet. In the beginning they were saying we don't want to send the clues to a private company, but this is the law, because these medicines, if they are uninsured, we have made contracts with the companies and they give it for free.
Those who are most affected by the dire situation are the ones with chronic diseases.
Oh yes.
Obviously, like diabetes or multiple sclerosis. I met a patient who told me that she could not afford the expensive medicine she needed for the illness, and the illness became worse. And then she went to the hospital. She was admitted to the hospital, and then after a week or so in the hospital, she was brought home, and then she had a debt of more than 2,000 euros to the state for this time in the hospital. And a few weeks later, the financial authority sent her a foreclosure for her home. Shouldn't, at least for these people with chronic diseases, you have a special program to avoid such
I told you before,
harshness?
Until this Friday, we'll have the ministerial decision signed that will change this thing. And they will not have to pay through taxation. If the doctor says that they really need, and if they have a chronic disease, of course they will need. This is the change we do now.
And will also change the situation that a growing number of children are not vaccinated against the common illnesses?
This is a total lie. All the vaccinations in this country, it's in the European level. We're not lower the European level, in children, I mean.
Well, according to the monitoring conducted by a group of Greek pediatricians, the proportion of children not vaccinated is growing. A group of scientists published a study in
I have already given to the parliament when some people from the opposition made me the same question, and I gave all the facts from our service about how many people are vaccinated each year. And you have always to remember that many of all these things you see are strictly political issues. People who want to object to the program and to the government find real problems and project it as being huge. But this is not the real icon. I will give you an example. HIV had an explosion in 2012, an explosion in this country.
New infections.
New infections, especially because of the drug-addicted people, that they were using the same needle and the one infected the other. this became a very big issue, and in the European Union, in the WHO, and in this country, TV were saying, BBC made a reportage and everything like that. In 2013, we made a very big program with Kelpno and the University of Athens. We gave for free hundreds of thousands of needles in all the areas of the drug-addicted people, and the new infections decreased by 49%. Almost nobody said anything.
Mm-hmm. About what? About
that of the decrease.
Of the decrease.
The increase was the first news. The decrease of 50% was some small lines in the newspaper. Mm-hmm. What I'm saying is, we have problems, but the half you hear are political issues.
Mm-hmm. Another problem cited by the international journals and published in the renowned...
I will give you an example. And I'm very fortunate you're here for the Stern magazine, which is a very respectable magazine, had a reportage about the hospital of Kilkis. Kilkis is a city in northern Greece. And they said it's a very old hospital of 60 years and very real problems of the hospital. But they didn't write, I don't know why, that we put in function the new hospital in Kilkis. If you take your car and you go to Kilkis, you will see the old hospital, which all what Stern wrote was real, but until now 3 months, the new hospital is already in function. We made a very beautiful new kitchen there for the people, which has already working now.
Yes.
And the old hospital is going to the new one. In the magazine I read about the old one, but there was no reference about the new one. I don't know why. I would like to ask them.
If you're right, the colleague has made
you can go and check it by yourself.
A mistake. Another very important figure which has been published by the renowned medical journal Lancet was that child mortality had increased by 43% in only 2 years in Greece.
We have objected to these elements and this article, and my team from the ministry gave a response to the magazine, which has been published, I think, now. It was totally untrue. This was by a team with Greek experts. Some of them were members of the opposition party.
So you think
totally.
Doctors publish wrong figures for political reasons?
For this figure, totally wrong. We sent all the figures to Lancet magazine.
And you think all these renowned organizations, for example, like Doctors of the World, but they say the same thing?
No, I'm not saying we don't have problems.
Yes.
We have huge problems. And for all this time of the crisis, many uninsured needed these medical, social places, and all these volunteers, doctors made a tremendous good job, and they fixed problems from the state, and unfortunately people died because the state couldn't do their job as we had to do. All the problems are true, and they were here, and we try to solve them as fast as we can solve a problem. Not tell me the wrong idea. The problems are here and are huge. But we are trying to solve these problems, and we are going as fast as possible. What I'm saying to you is, could a country bankrupt and not have this kind of problems?
No.
Can you show me a country that was bankrupt and everything in the society was good?
No, but in the cuts to the budget, you could have taken other priorities.
By firing, let's say, public servants?
Or by paying less for recapitalizing the banks.
But we haven't paid €1 for them. Who says this? I would say a bad word, of course. I said myself. Who says these things? Do you know how much money the Greek taxpayers have paid for the banks? No, can you tell me the number?
I know.
No, the number.
41 billion have so far
the Greek taxpayers?
Let me please finish my sentence. 41 billion euros borrowed money from the ESM has been invested in Greek banks.
Good. Huh? But these are money
and this money is not going to be regained by privatization.
Just. You are a sincere man. We borrowed, as you said, 41 billion. We have spent it now something like 30 billion, and we have 11 as a budget there. This money were borrowed by the European taxpayers. It was not our money. They are in our public debt, and we will start paying this money after 10 years. So I make the question again. From our own money, how much money we gave to the recapitalization of the banks?
Well,
now,
in the first round you did 5 billion, but that was before 2000.
The bank runs.
Yes, yes.
Exactly the question again. From our own money, because you said me before, we shouldn't make these cuttings of the budgets, and don't make the capitalization. I'm asking you again. Did we have this 41 billion in order to make the choice? Either we will give it to the banks, or let's say to the hospitals, or this money came for the banks from other taxpayers, and from our own money, we haven't already gave not even one single euro.
Well, but this is a very strange art of accounting, because you could have negotiated with the Troika about
giving us the money for the healthcare system and not for the banks.
More money for the healthcare system, yes, because I think when people are dying, you get the priorities wrong.
And we shouldn't do it. Because if we didn't recapitalize our bank, we wouldn't have 2 million unemployed, we would have 8 million unemployed. And if we didn't recapitalize our bank, we would have lost all the savings of the people in the banks, our economy would be totally destroyed, and hundreds of thousands of people would have died now.
Well,
so you have to understand, if you live in a capitalist world, you need to have banks to give money and jobs to the people. If you don't have the banks,
it's not a question of either or. It's a question of sequence and timing.
Let us take it from the beginning.
Yes.
Greece was bankrupt. Now, I don't know if you have the time or the desire to make this discussion, but in 2010, Greece was excluded by the markets. That means that we were bankrupt. At that point, we had two options. The one option, to be official bankrupt. That would mean at that point that we would exit the Eurozone, we would print our own money, and then we would do whatever the history would say. What I say is that would be 100 times bigger disaster, and for the healthcare system, that it happened.
If it would have been organized,
the other choice,
it would have happened on an unorganized level, of course.
But we didn't have time. It would be unorganized. We had to make the choice in 24 hours.
You could have declared in consensus with the other Euro states a moratorium and do a debt conference, as Germany had it in '53.
From the beginning. You are rational.
You started by the beginning, and I do so as well.
Yes, okay, I will answer. I will explain. Mr. Tsipras says that. But unfortunately, he doesn't know anything. See what the problem? We're in the Eurozone.
Yes.
Deutschland, after Second World War, was not in the Eurozone.
Yes, I know.
Second,
the
debt we had was in the private banks on 6 May of 2010. It was not in the states of the European Union as it is now. It was in the private sector. When you have a debt in the private sector, you have two choices: to pay the bond or not to pay the bond. You cannot negotiate with the private sector if you will pay or not.
Oh yes, you can. There is the London Club since decades, and the London Club is exactly for this purpose.
We negotiated at the end. It's the PSI agreement that we made in February of 2012.
Well, when all the major banks had already sold their sovereign bonds of Greece.
Yes. Why? Because if we hadn't paid the bonds that they were expiring in May 2010, in a few days from the excluded of the markets, then Greece and the Greek bonds will have no value at all. When this would happen, Greece would have to exit the Eurozone.
No, that's not true.
How?
That's not
How
true.
could it happen?
Because it would have depended on the political will in the other Euro countries, and because of their own because of their own interest, they would have prevented this outcome.
No.
Because what has happened is, by the credits given from the Troika, the only thing what happened is that your debt to the private sector has been substituted to debt to the official sector.
Let me make you another question, and you will, I'm sure I will persuade you.
Okay.
Let us presume that the Greeks would say, I will not pay because the bonds are in the private sector, and you will either negotiate with me, either I will declare bankruptcy. Okay, this is what you say, and Mr. Tsipras says. Okay, good. And let us presume that the European banks...
By the way, this is exactly what the IMF staff did propose.
No, didn't propose that. They proposed something totally different.
Their proposal was a debt restructuring, which should have happened on this level.
The debt restructuring was made in February 12.
Yeah, two years late.
A totally different matter, the organized debt restructure, and totally different the threat of bankruptcy. It's two different ways. See what the difference. Let us presume that Greece, who at that time had 350 billion debt, could blackmail all the other people by saying, either you will restructure my debt, either I will not pay. Okay. What do you think would Italy would do with 2 trillion debt? Would Italy would pay any bond the next day?
Yes,
France with
they
4
would.
trillion?
Yes, they would.
Nobody would pay anything.
No.
The only reason we pay our bonds is because we know that if we don't pay the bonds, there are consequences. The bonds have the value of this paper. This paper has the value of a bond of 1 trillion. The only difference between this paper and the bond is the consequences if you don't pay. If the European Union will accept for one time, for one country, that you cannot pay the bond and have any consequences, then all the bonds will have the value of this paper. This is the main reason whoever claims that a country can blackmail the whole markets has no idea about how the markets are working and what the European Union is.
Believe me, I do write about financial markets more than 20 years, so I have an idea how it works.
Give me an example that somebody did that in history and survived. See what European Union is. But can you have a camera? And pacta sunt servanda, can you show this?
Yes, we have already taken it.
This is European Union. It came from the Roman period, and this is how empire buildings.
But since we are now in this debate, what would have happened if
the bonds are this thing, pacta sunt servanda. If this doesn't exist, the bonds, the markets, and the European Union doesn't exist at all.
But don't you agree that if the ECB would have done what Mr. Draghi did in summer 2013, would have done the same thing 3 years earlier, the whole crisis could have developed very different?
Of course. The European made tremendous mistakes.
And that a debt restructuring of Greek debt could have been organized in a smooth way?
Of course. But what you say now is a different story. It's not if we would blackmail anybody. You say now, if we could make a civilized agreement faster. This is totally different about what Mr. Tsipras is saying.
Sorry, I'm not Mr. Tsipras. No. I don't even know him. I've never talked to him. I can't read Greek.
Go. It would be an interesting
interview. I have made my own judgment.
You should go. You should go. But see the difference. In 1953, Germany was, after the Second World War, was almost ruined and destroyed, and the other countries of the West wanted to save the west side of Germany because they wanted to make it better, as an example, from the east side.
They needed an ally.
So they needed an ally, they needed a good example, and they paid. This is the true story.
Yes.
In 2010, if they would come day one and said to us, take as money as you want, spend it as you want, and we were spending in the bad way in the past. Do whatever you want, and you will have no consequences. The next day, no European country would follow any rule.
But that wouldn't have been the proposal. The proposal would be a conditionality which would make Greece survive without letting people die because of a lack of health care.
Now it's a good question. So there were two big mistakes. The one was from our side and the other was the European side. The first memorandum, which we signed in 6 May of 2010, was a wrong text because what they were telling us to do, the interest they had put on us to pay, and the reforms they had put on us to pay were wrong.
Yes.
So we accepted a wrong text that was not able to put us out of the crisis, and this made the people to suffer much more. Why this happened? For 2 reasons now. Because we were not prepared for this crisis, and second, because European Union was not prepared for this crisis. Because the history time had changed on September 2008 when Lehman Brothers was collapsed.
Yes.
And nobody understood on September 2008 what the effects would be in the European Union.
And then 2 years later they were so afraid to create another Lehman event that they better sacrificed Greece and its population than to go the risk.
No. There was no risk.
Yes, that's what happened.
If they would pay the money in Greece in the beginning, all the European Union would have destroyed forever. Nobody would pay anything, never again, in the Western world.
I know this moral hazard argument, but it could have been done on a conditionality which is reasonable and sensible.
It could be, but if you have been in any cabinet of the European Union, you will understand that one of the main problems of the European Union is that all decision goes very, very slow, because many people and many countries will have to think, discuss,
consider,
debate. So the main problem of the structure of the European Union is that it goes very slow. But the crisis was running very fast. So no one was really prepared for this crisis. Not Greece, not Europe. It was not.
I agree. No one was prepared.
It was not a matter of punishment. Nobody knew really what he had to do.
But there were 5 months' time from when the real figures came out in December 29 until the first memorandum was signed in May. 5 months' time. In 5 months, you can prepare a lot. And do you know the IMF? The IMF staff, they knew what they are doing.
What's your name?
Harald Schumann.
Harold, okay. You permit me to call you Harold?
No problem, yes.
Okay. See, Harold, what's going on? In order to change the directive for smoking, we were discussing it, only the directive for smoking, for more than a year. So what you say is that an organization that needs to change the directive for smoking more than a year could solve the crisis in a more effective way in 5 months.
I tell you another example. When Lehman happened, it took only 10 days for the whole Western world, including my country and all the other European countries, to spend more than $1 trillion, it was a dollar figure, more than $1 trillion for their bank rescues. So if it's urgent, they are ready and they are able to take a very fast decision. It depends on what's at stake and whose interests are at stake. And it was because Greece was weak and it had a weak and dysfunctional state. Because of this, it was very easy to sacrifice your country.
No. I have total different way of thinking. Nobody wanted to sacrifice nobody in the European Union. The truth is, they didn't know what to do. See what the difference with the example you said before. First of all, Lehman Brothers collapsed in the United States. And from this 1 trillion, the 700 billion were issued by the American Congress. If you remember, they had to vote it 2 times. The first time in the American history, they had to go for the same legislation 2 times. Because in the first time, even in the American Congress, they voted no.
Okay, let's stick to the European part, which was still 300 billion.
Step by step. What's the difference between the United States and the European Union? The Americans decide fast. The Europeans decide slow. So let us go down to the 300 billion. The 300 billion were money that, let's say, Great Britain, for recapitalizing the Scottish Bank.
Yeah, the RBS.
The RBS.
Royal Bank of Scotland.
And the Deutschland for the Haselblank, how should we say this bank?
Hypo Real Estate.
Okay, I don't remember the names.
And Commerzbank.
They had to recalculate their own banks with their own money. So they could be fast enough. they didn't have to decide it as European Union. Great Britain decided, and Germany decided to recapitalize with British money, their bank, and with German money, their bank. See now the difference. Now we had to find a way. The Germans and the French and the Italians and the Spanish and the Belgians and the Slovenians and the Austrians and the Danish and everybody else to decide how they will spend their money to save our banks.
Except the Danish, because they are a member of the Eurozone.
I said as an example of the member of the European Union, of course. Only the Eurozone paid. But you can understand the difference?
Yes, I do understand the difference.
When you talk about politics, can you take this thing there? This is from the ancient Greece. This is from the Roman Empire, but this is from the ancient Greece. It's very, very useful. It was written by an ancient Greek philosopher that was called Agathon before 2,500 years. Τον άρχοντα τριών διημέμνηστε. The leader must always remember three things. First, he leads to people. Second, he leads under the law. And second, he will not lead forever. Let us go to the first one. We lead people. So we have to be realistic. You cannot expect by the people to do something that in the real world cannot happen as we think that it could happen. So what I say to you is, it's not that the European Union is bad and they wanted to punish Greece. And it was not that the Greek politicians of that era were something like traitors, as some things believe, in order that they were bought by the banks in order to do all these bad things happen. It was a huge crisis to people that they were not ready to deal with it, and in a structure that it was designed to go slow. And this structure had to learn how it could decide fast. And that needed time and produced a lot of mistakes. Mistakes from their side and mistakes from our side. IMF, you said before, who has much bigger experience to bankruptcies than the European Union has.
That's the reason why they knew what would happen.
Of course. The IMF was saying the truth.
They said that if you do these cuts, then this will bring Greece a very deep recession and it will be counterproductive.
It's an organization that all the experience they have is how to dealing with bankruptcies. But the European Union was a union, an organization that knew nothing about bankruptcy because the nearest bankruptcy they had was decades before. So when they were in the same table, they weren't speaking the same language. It needed some time to speak the same language.
But what has happened is that the internal rules. What has happened is that the internal rules of the IMF had to be changed because the European American majority in the executive directors board of the IMF decided that to avoid a systemic event is more important than to avoid a depression in Greece.
I think they decided good because it was it was a very big threat for the Western world.
But shouldn't they have offered a compensation to Greece?
I told you before why it didn't happen. I told you I always want to look at it by the human perspective. I'm telling you again, no one in the European Union and in Greece were ready for this shock. So we lost a lot of time and we made a lot of mistakes, and in the European level and the Greek level. What this government is trying to do now is to try to fix these problems as fast as possible. But you cannot change societies and restructure economies in 24 hours. It cannot happen.
Okay, one last question. If it turns out that the critics were right, and as a consequence of your policies, a lot of people have actually died, only if it turns out, aren't you afraid of being held accountable for this in court?
No, totally. No. We haven't taken any decision by any other criteria about how to save people's lives. All the things we have done is how to find a way to save people's lives. Because what I said before is, we always thought, and we still think, that having a real bankruptcy could kill hundreds of thousands of people in this country. What we say is, Unfortunately, we were bankrupt, and bankruptcies are a bad thing. It is wise decision for the people, for the countries, for the states to avoid bankruptcies by being careful about how they use their money.
Mm-hmm.
Our government is trying to save people's lives, not to kill people in order to save the banks, as you said before. We recapitalize the bank for only one reason, to save people's savings and make the economy start faster in order the unemployed people to find real jobs.
Okay. Thank you very much.
Thank you, Harald, very much.